There we go. All right, there we go. So, Dr. Wagner, thank you so much for joining us. I'm going to try to do a little formal thing like Honey does, but I'm not going to be as good as her.
No,
Um,
you're great. You're great.
we are going to make it very informal. I just wanted to have you on. I know that a lot of people have you on, and I really appreciate your time coming to do this because peptides is a major world out there, and there are so many good things about it. People have so many misconceptions about it,
Mhm.
and I just want to try to help explain why peptides are so good for us and how they work. And we all want to be healthier. We all want to feel better. So have at it.
Yeah. I mean, where do you want me to start? There's a million ways that we can skin this. So,
I guess to start with, what are some, okay, just tell us. I know you do this a lot on all of your things. Just basically what peptides are and why they work so well with the body.
yeah, I mean, it's really a paradigm shift that we have to talk about too in terms of peptide versus traditional medication and also like the Western mindset of how the body works. It's like you go into the doctor, you have a symptom, they have a pill for every ill or for every symptom. So it's more symptom management instead of system or root cause. And peptides, again, basic understanding, there's short chains of amino acids that act as signaling molecules in the body. They work by mimicking natural biological processes to regulate hormones, promote healing, as well as optimize cellular function. So peptides often enhance the body's natural ability to heal rather than force it into a specific outcome. Versus traditional pharmaceutical drugs, they're synthetic chemicals designed to target specific symptoms or block biological pathways. So just in and of itself, we're working against the body. We're not enhancing anything. So they often act as enzyme inhibitors, receptor blockers, neurotransmitter modulators that work against the body's natural processes. So those are just like two things that we need to distinct between peptide therapy and what we're traditionally used to when we're going to the doctor.
Yeah, for sure. I love that it goes back to building on the what your body is made for. Like your body knows what to do, and this just helps, gives it tools to do what it's supposed to do better than it's able to do without them. I had a lot of people, and I do have to go back to this and tell people, I had one girl in particular 2 days ago ask me, she said, are they like safe? She said, they're not natural, but because she's really into all the natural stuff. And I said,
Right.
well, that's right. But I said, how do you feel about insulin? And she said, what do you mean? And I said, well, insulin is a synthesized peptide. Like, that's exactly what it is. She said, oh, well, that makes me feel better. So
Yeah.
I think when people get out of their mind that this is just, hey, this is something that's created that we're injecting into their bodies, but it's really, how do you, other than that, how can you explain that it does work with the body? It's not natural, but it's synthetic to replicate the natural.
Yeah. So like, for example, like BPC 157, it enhances gut and tissue healing without interfering with other physiological processes because again, it's just acting as a signaling molecule to help the body's natural processes. And then again, if your friend's worried about if it's being safe, ask them about NSAIDs, how they feel about that, because NSAIDs reduce inflammation, but can also cause gastrointestinal issues by inhibiting protective prostaglandins. Like, and people don't even like think twice about taking like an NSAID, like ibuprofen.
Right. Yeah,
Take
for
it.
sure.
They don't realize that the downstream effects that what it's doing. And again, in terms of like side effect and safety profile, again, peptides are naturally occurring substances in the body. Your body already makes BPC 157. It already makes the growth hormones, but we're helping to enhance the natural process because as we age and as we lose that cellular efficiency because we're exposed to toxins, EMFs, heavy metals, poor food quality, we're not connected to the natural rhythms of the earth, then all those processes slow down. And the peptides are just reminding your body on how to do that more efficiently. So it's building that up, but it's not building a dependence on it. Unlike other medications, which have a lot of side effects, which again, we don't think much about, like steroids, antidepressants, opiates. These have a lot of like long-term effects on the body and can lead to dependency, organ damage, and metabolic disruption. And again, another example of a peptide that we can use is, the growth hormone secretagogues, sermorelin or sermorelin, however people like to pronounce it. Again, all that's doing is helping to re-regulate your body's natural production of growth hormone. So it's going to work very differently in you versus what it's going to work with in me, because it's working with your biology and then it's working with my biology. So it knows how much growth hormone my body needs to function efficiently. And then it also knows how much your body needs to work efficiently. So it's not, if we're going to give you growth hormone, it's not going to make you huge. Like, it's going to work with your body's natural rhythms and cycles and your hormones. And then for me, it's going to work based on my biology as well too. And that's what's really nice about peptide therapy is we can give a lot of different people the same peptides. And what it does is, the way I like to think about it, it meets them where they're at instead of like, again, forcing something. So again, in terms of safety profile, just look at a lot of the stuff that we take on a normal day basis without thinking about it twice, and how
Right.
damaging it is on our systems and how much of a dependency.
Yeah, that is so true. We don't think about things twice. Just pop a Motrin, pop a Aleve, and just mask that
Mhm,
pain.
mhm.
Um, so just go ahead and talk a little bit about the. Oh, did I freeze up? Can you hear me? Okay.
Yeah.
Um, okay. Uh, let's talk about the BPC a little bit since you went ahead and or that one or the Samorlin, whichever one you want to kind of hit first, since you brought both of those up.
Mhm. So BBC, it's a healing peptide. It's a 14 chain amino acid, so it's smaller, and it's synthesized from the gastric juice within your stomach. So again, your body naturally produces these things, but again, as we age, you know, they always say like once you hit a certain age, like you feel all the aches and pains, or you just wake up like achy every morning, as opposed to like when you're a kid, you can go all day, you're not achy because you're producing a higher amount of a lot of these peptides, stem cells, other bioregulators in the system. And what we're able to do is we're able to mimic that, 18, 16, 17-year-old cellular state by adding in the peptides. And BP157, it's great for any musculoskeletal issues. It helps with regeneration of muscles, ligaments, tendons, and joints. And the way that it does that is through a process called angiogenesis. All that means is it increases blood flow and blood vessels throughout the entire body. So when we increase blood flow to an area, we're getting more nutrients, we're getting more stem cells, we're getting more healing factors to that, but then we're also getting the quote unquote toxins out, the inflammation out from that area. So it's keeping that system going more efficiently. Other thing too is it increases what's called as your growth hormone receptors. So then there's more activated sites on that point of injury that the growth hormone can set up shop and help again with that healing process. We also pair it with that TB500, which is really important. And there's a lot of overlap with both of them. But TB500 is specifically synthesized from your thymus gland, which has a lot to do with your immune system. So whenever you have like an acute injury that goes chronic, that triggers an immune response. So we have to address the immune system whenever we're addressing an injury. And if we don't address that, what happens is we're going to lead to tissue destruction within that area, which leads to a lot of scar tissue, which, once people get an injury, then they're more likely to re-injure it again because the integrity of that joint is is weakened because of that scar tissue. So if you get an injury, like in your shoulder, wrist, your elbow, whatever, by us addressing the immune system, breaking down that scar tissue with that TB500, increasing stem cell production as well too, we're able to not only heal that injury, but decrease the chance of that injuring again, which is huge.
So, just a question. I have, well, I'm about to be 40, and
Mhm.
I have, these knots in my back, and I have my neck is, it hurts when I move it a certain way, and my wrist has started hurting, and joints and just different things. And does it target? It just sends receptors to all these areas? Is
Yeah,
that
I
kind of how
mean,
it works?
if you have a specific area that you're trying to focus on more, you want to inject close to the site of injury. Like, let's say, like an acute injury, like you just hurt something,
Hmm.
even a chronic injury, you can do it to the site, closer to the site. But again, these things work systemically throughout the entire body that, I have patients that come in with a shoulder injury. We treat the shoulder, but yet it relieves the arthritis in their hands.
Yeah.
So again, these things are working systemically, and that's just from a musculoskeletal issue. The other powerful part about the BPC and TB500, especially TB500, great for post-stroke, MI, or concussion patients. Any sort of like neurological condition, someone just has a stroke, bam, get them on that TB500 like right away. Like it
Wow.
will
Okay.
generate, yeah, it almost, there's been some cases where like there's literally no sign of stroke afterwards if you can get him on it right away. Like it's crazy. So it's
That Does it matter what kind of stroke they had? Like if it was like a clot or a bleed, or does that make a difference?
not to my knowledge, it doesn't really matter. Because again, you're able to increase those healing factors within the body. So if you think like MI, stroke, concussion, think that BPC TB500 combo, that's going to give them like a great opportunity to recover. And again, everyone's different. Some people might experience 100% recovery. Some people might only get 50, some people 80, but that's better than nothing. That's better.
Absolutely.
There's no hope in conventional medicine with that. It's just like you just like slowly deteriorate after those. You don't get any sort of function back. And again, this is just peptides. There's hundreds of other things that we can stack on top of that to get more function back.
Right.
Um, so there's just like a lot, it's again, these are working on full systems. So it's never just like a symptom that we're trying to treat with these. We're trying to treat a full system and we're trying to treat a root cause. So even the symptom itself is literally just like that check engine light that comes on your car. And it's like, I have these symptoms going on, but yet the symptoms are not always like where the cause is. So you have to look deeper within the system. That's what's great again about peptide therapy is not only does it deal with the symptom, but it deals with the system. So other stuff get better and improve as well. Again, I had a patient who he likes to golf. He has chronic hip pain. I put him on a combination of BPC, TB500, and GHKCU. Within 5 days, he called me. He's like, Dr. Josiah, I wake up with no hip pain anymore. Not only do I not wake up with no hip pain, but I feel like my mind is clearer as well, too. So sometimes people's cloudiness in their mind is one, it's caused from multiple different layers of things. Chronic pain, because that puts a lot of tension on your nervous system because your nervous system only has so much bandwidth. And that person is in chronic pain. It fills up a lot of that bandwidth of that nervous system. So we just like offloaded that. And then we can bring down that inflammation. And then we can also balance the immune system. So that in and of itself clears up the mind as well, too. So again, there's multiple layers of things that we can affect. So it's never just like never think about these things in terms of like symptoms. Think of these things in mechanism of actions, how they work, and then you're able to apply them to a broad spectrum of symptoms. Because again, I use a lot of the stacks over and over again for multiple different cases. Everything from, my super sick cases, autoimmune cases, complex cases, all the way to like my high performers. I put them on very similar stacks because again, it meets them where they're at. It either brings them back up to balance or it helps other ones just excel where they're at. Again, the GLPs, there's multiple ways you can use GLPs. Maybe your entry into GLPs is where you're taking it for weight loss. So you're on like a higher dose, you achieve your weight, and then you're like, I like the way I feel on this. So then you go to the microdose. Now you're getting all the longevity benefits of that GLP-1 as well too, because weight loss is literally just like the tip of the iceberg with the benefits of these GLPs. It's almost like a side effect of what the GLP is actually doing deeper within your system, how it's improving kidney function, liver function, lipids, bringing down inflammation, helping to regenerate the pancreas, helping to regenerate the cardiovascular system, helping with neuroinflammation. It's just like it's so cool because people can come in with any types of symptoms and I can feel very confident once I run them through a couple cycles and improve overall cellular efficiency, improve hormones profiles, get inflammation down, balance the immune system, then it's just like muddy water. Eventually that sand starts to settle because I'm focusing on, again, systems. And then the symptoms, that sand, that mud starts to settle. And then the water becomes super, super clear. And I can see what like couple little things are the actual issue. And then from there, you just go in with your fine chisel tools and just fill out the rest. But again, you can get people 80% of the way just with like very simple stacks that are already available.
Yeah. So speaking of the GLPs, I lost my weight 2 years ago. I lost 35 pounds and I have a history of high cholesterol. And after that, I went for my yearly doctor's appointment. My total was like 194. And I was like, well, dang, I thought it was going to be lower than that since I lost this weight. So I was like, whatever, it wasn't crazy. They didn't put me on any meds or anything like that. So this year I went, nothing's changed. My weight's the same, just been on that low dose of GLP-1 and my cholesterol was 168. And I was like, heck yeah, like
Yeah.
I'm staying on it.
Mhm.
We're going to see what this is next year.
Yeah.
So, definitely seeing the other benefits of it. And like that's what got my dad. He's like, okay, I think I need to get on it now. And I was like, yeah, because
Yeah.
that's my only difference. And I haven't been on, I know cholesterol meds, they make you feel like crap. I don't want to be on that.
Well, and
And
again, it builds up dependency and it causes other downstream issues because again, all right, cholesterol, super, super important. Dietary cholesterol only really contributes to about 20% of your overall cholesterol. Your body produces the other like 80 to 85%. So it's not dietary cholesterol. Why does your body produce this much cholesterol? Because your cells have what's called as a phospholipid layer. This is made up of cholesterol. All your cells in your body are made of cholesterol. What else needs a lot of cholesterol? The brain. The brain is a fatty organ. So cholesterol is important for your cells. It's important for neurological function. They call statins the memory eraser because it literally starts to erase your mind. So yes, lowering cholesterol through medications is one of the worst things that you could possibly do for your body because there's a reason that that is happening. We want to address the root cause. We don't want to go into other issues. And yeah, just like you said with your parents, like, yeah, I put my dad on the GLPs as well too, because it helps with that neurodegenerative decline. Because again, this is the progression of what happens. Insulin insensitivity first happens in the muscle. Once we lose that, we lead into all these other biomarkers going off, all these other alarm systems. Once you lose that insulin sensitivity, we have chronic inflammation. So we have that chronic inflammation, we have immune system dysregulation. When we have that immune system dysregulation, we get a downregulation in our mitochondria. And then this is where this downstream effect leads to neurodegenerative decline. So it all started with upstream with that insulin sensitivity. So if you can restore your body's ability to uptake glucose and oxidize fat you're teaching your body to run on a two fuel system, which is what we need to do. So being on a two fuel system, what that means is your body has metabolic flexibility. When your body has metabolic flexibility, your body is more resilient. Again, my goal is never just to treat the symptoms with the patient. My goal is to make you more resilient and more tough and make your body more robust, because I can put you on the perfect plan, but I can't guarantee that you're going to have the perfect life, because
Right.
life happens and stress happens and everyone has to go through stuff. So it's like, if I can prep your body in a way that it's like you can weather the storms of your life and your body can handle that. That's really like what my goal is what I'm thinking about. I'm trying to make your body stronger through that process. So you have more flexibility and range to handle. Let's say, for example, if we can boost your metabolism, you can handle, an extra 300 to 500 calories on the weekend, or when you get together with family. Like, you don't have to worry about the scale going up. It's like your body can handle it because it knows what to do with that. Let's say you go a couple nights without sleep. It's like, yeah, that's not ideal, but there's checks and balances in place that we can do that you've been doing day in and day out, that your body can easily recover with that within a couple days, as opposed to like that throwing you off for like a month. So most people have a hard time even recovering, just like couple nights like that could throw them off for a long time. So it's like the faster I can bring your body back to homeostasis, the better you're just going to be able to bounce back from life, because life is dynamic. It's not perfect. It's far from perfect. Once you're like, all right, I'm going to do this once this and this is in line. That never happens.
Right.
That's not real. That's not real.
Right. Um, yeah. So with this, um, we're kind of going back a little bit, but well, I think I may come back to that because I want to stay on subject.
Yeah,
So
we can go right to
let's,
the or however you want to do this.
yeah. So, okay, let me see, because I've had a few questions coming in like as we're talking here.
Because I
So
can
I
talk
know,
tangents forever, so
do what?
I can talk on tangents forever.
Okay. Well, Lisa, what were you meaning? What dose? What dose are you saying would change? I think that's you. Is that you?
Yeah. So can you hear me?
Yeah.
Mhm.
Okay. So if you have somebody that comes in like acute versus like
Uh,
chronic, or let's say like it's fascinating actually all the stuff that I've learned about the angiogenesis. And I'm actually just my background is I've been a cardiovascular nurse practitioner for like 20 plus years. So this is exciting to me. But so if you have somebody that had an acute stroke or acute or MI, something of that sort, would you change your doses than what we are normally doing?
yeah,
I mean, I think with the BPC, which I put that my husband on that for his chronic pain, and he does it 3 times a week.
100%.
So it doesn't seem like for an acute event, you'd probably want more initially.
Yeah, so you'd want more. You'd basically cut that dose in half and you do it more frequently. So any
Okay.
acute cases, I'm cutting that dose in half and I'm doing it twice a day, 5 days on, 2 days off. Because I want to
Okay.
send that signal more frequently with that patient.
Gotcha.
Yep.
That makes sense.
And then more like your chronic patients, it's like the 5 to 3 days a week, just like once a day, but you're doing like a higher dose. So you're getting like a bigger pulse, as opposed to
Okay.
like smaller pulses multiple times.
And the other question that I had too, Lauren, if you don't mind, is that how do you like evaluate or do self-assessments? Because it's so subjective, I think, and sometimes you don't realize like how well people are doing or they don't recall like how bad they were other than they're like, oh, I'm feeling better. But can you quantify that or from like a scale of 1 to 10 is what I'm used to doing in the hospital, on how they're feeling like physically or does that make sense?
Yeah, I mean, just ask them different questions not related to what they came into. Like, ask how your sleep is, or ask how your energy levels are. How has mental clarity been? How has overall aches and pains? Are you waking up achy in the morning when you get up? Like, try to think of other questions outside of like, let's say they came in with shoulder pain. How's the shoulder pain now? Like,
Yeah.
think of other things too that it's going to address that maybe they're not conscious of, that oh wow, like I haven't been waking up with aches and pains in the morning. Like, oh, I don't feel as stiff when I get out of bed. I don't feel as cloudy in the morning, like I need to like run to that pot of coffee just so like a brain cell feels like it's working. My sleep is better. Like I'm sleeping less, more undisturbed. Like I'm able to sleep through the night, or just like try to ask regular everyday questions like that so that they can see like, oh wow, like it is doing something more than just the shoulder pain of what I'm dealing with. So is that helpful?
Yep. It is. Mhm.
Yeah, yeah. But yeah, it is
Um,
super specific.
so going back to the GLPs, I know that we have seen something. Well, you've been talking about the neuroprotective ones.
Mhm.
Um, so which ones are the best for like, preventing or lowering your risk for dementia or Alzheimer's or, that kind of area?
It it's multifaceted and it's multi-system. So I mean, technically they all are going to improve your risk for that because again, they're hitting multiple different things. It just depends on again where that person's biology is at. So everyone is going to respond differently to different peptides. So, you know, the GLPs help in their own way with that. TV500 and BPC help in their own way with that. Some Morlin definitely helps in its own way with that. Glutathione can also help with that, and NAD can also help with that. So again, they all help. That's why you just don't want to get stuck in one camp with it. You want to learn how to stack them and to cycle them so your body is not missing anything that it needs. So like think of your body as like a puzzle piece. Each time you take one of those, you're adding another piece to that puzzle, but each peptide can only add a certain piece. So it's like you're working on this corner over here of the puzzle. Great. I've gotten all that. That's great. Now I need to work on this part of the puzzle over here. Now I need to work on this part. Now I need to work on this part. And then once you get a lot of those pieces in, then you're pretty much just on maintenance mode and you can just really cycle through the ones that you personally feel the best on. Like I know about all the peptides and I recommend a lot of the peptides, but I personally don't use all the peptides because I have my stacks that work well for me and where I'm at with my lifestyle. As I age, that could change. As my life goals change, that could change as well too. What I like to use and what makes me feel good and what makes me feel the best. But I have my stack that I go to more than often, and then I'll sprinkle in other ones throughout there. So it's like you really want to use and utilize all of them, honestly. So like there is no best or better with peptides because again, it's working with your own biology and everyone's own biology is different. So what's your best is going to be different from what's my best. And you're going to know that. So because it's going to balance you on, you're going to be like, wow, like I feel really good on that one. Like that one's really good for me. So this is where people get into the confusion of like, which one should I take?
Mhm.
It's again, understand the primary action. That will help you first figure out what you're going to do. Again, if it's a musculoskeletal issue, if it's a stroke, concussion, neurological case, BPC TV 500. It's more like the weight loss, resetting the metabolism, GLPs. Again, if it's helping to build more muscle mass, improve levels of stage 4 deep sleep, that's going to be like your growth hormone secreting peptides. If it's to help with detoxification, glutathione, improves levels of skin, glutathione, improve mental energy. It's going to be like your NAD. And then I haven't said much about GHKCU, but then GHKCU is great because it's so many things. Most people know more for like the aesthetics, like skin tightness, collagen production, um, helps with pigmentation. But the real magic is it's super antioxidant and it helps with stem cell migration. So it's going to improve levels of stem cells, which helps everything within the body. And then also antiviral and anti-C word. So That's really great as well too, because again, it's helping to modulate the immune system. Anytime you think cancer, think immune system. That's really where you have to start, because the immune system's not able to see the cancer cells and destroy them. That's where the cancer comes in. So anytime you associate cancer, associate immune system dysfunction. So we can regulate that with a couple different peptides. GHK is definitely like one of those peptides, but again, we want to use a combination of things.